Great. Good morning, everyone. Welcome to our summer survival series. Today's topic is understanding and addressing your child's stress and anxiety during the pandemic. We're very lucky to have Dr. Mary Murphy back with us today, and she will offer strategies you can use to help your kids deal with their often overwhelming emotions and turn them into opportunities of growth during this time. For those of you who are just joining us for the first time, Dr. Murphy is a licensed clinical psychologist and specializes in counseling, executive function, and academic coaching, psychological testing, psychotherapy, and biofeedback. She continues to work with elementary and high school students during COVID-19 school closure through tele-therapy. Her counseling practice focuses on helping children and adolescents affected mood disorders, neurological conditions, and substance use. She completed an advanced fellowship training at the Yale School of Medicine and currently is an adjunct professor at WestConn and in private practice in Newtown, Connecticut. You can find out more about Dr. Murphy and the information presented today, including her PowerPoint, on our website and Facebook page. www.spednetwilton.org is our website. Your moderators today are Eve Kessler, founder of SpedNet Wilton, Carolina Corrigan, and I'm Janine Kelly. Again, for those of you who are new, we just have a few ground rules. Please feel free to ask questions at the end of Dr. Murphy's presentation through the Q&A button. If you use the chat, we can't keep track of the questions that were answered, so please use the Q&A button. Also, be mindful that this is an open forum and that it's being recorded and we can't necessarily guarantee confidentiality. So just be careful with your questions not to reveal any private information. And lastly, the documents and information provided in this webinar by Dr. Murphy or the moderators are for informational purposes only and are not intended to replace the need for legal or therapeutic advice. So with that in mind, we turn the tables over to Dr. Murphy.
Thank you, Janine. Thank you, everyone. I really appreciate being able to be here again. SpedNet is becoming my home away from home. I really love working with you guys. And this is, I have to say, this is, one of the most near and dear topics to my heart. Anxiety is a topic that I talk about a lot. It touches on and is such an integral part of the populations that I work with, and I'm so passionate about working with kids who have ADD and also kids with executive functioning difficulties. They often, never get through any of that without having anxiety. And then there are those who have anxiety alone who I see for therapy. So it's a topic that is just, throughout my entire day with every single patient, it seems, and every student that I work with. So I thought that we all thought that it would be very fitting to talk about anxiety now, especially during the pandemic, because of the expected and the increases that we're definitely already seeing. And for our population, our audience of SpedNet, the reason why we felt it was so important is because anxiety is the most common co-occurring condition that occurs with kids, like our kids that have maybe learning disabilities or ADHD or autism. And we know that the pandemic is bringing about a worsening of these conditions. And so I'd like to talk about how to help figure out basically what steps can we take? What can we do? So it's the first step when it comes to anxiety is focus on what you can control, right? What you can do. And so that's why the focus of the talk is identify what we are looking at. So that's starting with the basics of what anxiety is. So, stress versus what is real clinical anxiety. We're going to talk about that difference. And then what the added impacts are now that we have COVID. And then most importantly, what can we do? What can we do as parents? And then what can we hand off and ask professionals to do for us? And again, within, our standard recommendation used to be just, okay, we'll go to therapy. Well, COVID changes the parameters of what's available to us and how that is available to us and how to access it. So I'd like to give some advice about how people are managing during this time. Just for background, I just wanted to explain, anxiety is the most common emotional issue that we see for children amongst all the different mental health conditions and stresses. And what we notice is that there's an increasing trajectory for them. So when they're very young, between 2 and 5%, it's actually a pretty high percentage that kids qualify for a diagnosis of anxiety, almost 10% of children. And as large of an amount of people that sounds like for kids that age, by the time they reached the teenage years, it actually gets up to 31, almost 32% of kids that if they were put before a provider, they would qualify for a clinical anxiety disorder. They would meet criteria for it. So the reason why I bring this up is to say that what we think we're seeing, we're most likely right. That, you know, our parenting instincts, our teacher instincts, our gut instincts about what we're seeing with our kids, based on the prevalence, we can say, honestly, this is probably what we are seeing if we ever have a question about whether this is something that needs to be evaluated, because it is extremely common for kids. As the pathway goes on and you get older, it really does always shift towards females having anxiety more. Throughout their entire course of their lifetime, women are 60 times more likely than men to experience anxiety. So we don't want to overlook the males, the boys, and, you know, our boys in our life, but there's a higher expectation that females will be struggling with this. And my main point really is that anxiety is treatable, and there's so many things. And I don't mean just treatable clinically, but treatable in the sense of intervenable, right? Like we as parents can intervene and get to be able to intervene with the fact that there's, you know, so many kids that actually qualify for a diagnosis, but only 80% of them are not getting treatment. So there's a huge opportunity out there for us to intervene for things that we as a system have been kind of missing routinely. So this is the number one thing I think that parents always want to know. Okay, what am I seeing? I see my kid behaving a certain way. Is this just stress, or is this real anxiety? Should I be concerned about this? Is what a parenting question that we get all the time. So everyday stress, I don't want to pathologize this. I want to make sure that everybody understands stress is important. It is actually functional. It actually helps motivate us. It helps to move us from point A to point B. It's our survival mechanism. It makes us, it's adaptive. It motivates and keeps us safe. You know, I always, you know, joke about this one thing. So I can't say stop me if you heard it, because nobody can actually like interact with me. But if you've heard me, you probably have heard me say that in our you know, evolution of people, we literally come from very anxious people. Evolutionarily speaking, we would not be alive today if our ancestors were not as anxious as they were. They kept themselves safe and they survived and they got through, and they didn't just sit there and say, I hope it all goes away. You know, they went out and looked for food. They took care of themselves. Anxiety is when it goes beyond that point, but everyday like stresses and concern and worries, those are tied to situations that we respond to, and it gets us to act in an often productive way. If we didn't worry about being on time, we wouldn't get to school. We wouldn't be good employees. We wouldn't be good students. So everyday stresses, what you see with kids, are everyday worries in response to a stress. So the signs that you see that it's not something for us to quote unquote worry about is when you see your kid be able to quickly move on after they've had a worry or a concern. So they can function in their daily life, but they come up against a worry, they worry, but then it's over. It's often a situation, you know, a test coming up. The adjustment to being home is a stressor, and that is exactly what we should be expecting them to be going through. Whenever they're trying something new, meeting new people, in COVID land, we are dealing with lots of different new stressors, and they should be adjusting, and you should see a peak in stresses. Now, what goes over the line into what we can say is a clinical level of anxiety is when you have worries in response to those stressors that just don't go away. There's a certain level of distress that continues, worries that continue on, and it interferes with functioning. For example, never getting back into doing their schoolwork because they are, you know, set off course for the entire day. They're just kind of off the rail and they can't pull it back in and actually function in the area that they most likely need to function most is at a school type of work. because that's their job, is to be students. So if they can't function in that primary way, relationships with you and your family, of course, is also important. But if they can't function as a student, or if they can't function in the home and have positive relationships, because they're so worried and anxious, and it's getting in the way of that, then that's when we say there's been a clinical diagnosis. So it's when you have moderate, not just low levels of anxiety. And often a big turning point for kids is, or for other adults as well, is when you would diagnose anxiety is often when physical symptoms start to emerge. So when you start to see things like heart pounding and muscle tension, and kids talking about having stomach aches and headaches, trouble sleeping is a huge red flag. It's like a distress signal for kids. Instead of a fever, kids develop these problems. And they often have these worries, these cognitive symptoms that are thought loops that they just can't turn off. And this is often why it results in trouble sleeping as a primary symptom. So it often, I never see a kid with anxiety who sleeps perfectly well. It just goes hand in hand. You will expect that when it gets to a certain level of anxiety that's troublesome, and where you might think to bring your child, virtually bring a child to a provider, it would be when they start to have sleep problems. It's a common red flag for us. And then avoidance behaviors begin. Things like not doing the things that they used to do, excessively using things to, in a way, I call self-medicate. And I don't think that's too strong of a term. I think that with anxiety, the kids do a lot of self-medicating. They numb out and they zone out on purpose. And I don't want to say on purpose. It's more subconscious. They just notice that they feel better and they stay where they feel better. Completely natural, right? Like, this is what people would naturally do. They continue to do things that make them feel better. And then they avoid the things that make them feel anxious. And then soon enough, they're only doing, kind of exclusively doing, the things that are making them calmer and soothing them. I spend a lot of time talking to kids about what video games they play. And you will find that a sense of calm comes over their face. They talk about the building that they do, or the rewards that they earn, and the feelings of pride that they have. There's this entire world that when they delve into, they start to feel like confident and in charge of themselves and in control. And when anxiety is about feeling out of control, video gaming becomes this oasis for kids. And so I don't want to pathologize that. I've spent a lot of time talking about what the clinical definition of kind of like the excessive use of gaming is. But for just as a warning sign that kids are having trouble, spending time on devices and binging on games and Netflix and social media, those are distress signals that are important for us to talk to them about. They very much are a sign that they need to delve into something to make themselves feel better and soothe themselves. So I think that I'm getting to parent recommendations soon, but I just wanted to highlight that now, that it's a very good thing to talk to your kids about the choices that they make. Not, do you really want to spend 2 hours on your video games today, but why they choose what they choose, and get to know why they're getting something out of the gaming. So just to let you know, there's really these two. Our Bible for making diagnoses for anxiety is called the DSM. And just so you know, there's really two main categories, but the most the common disorders that are diagnosed. But I left out separation anxiety. I'm sorry, I'm not sure why. But these are generalized anxiety disorder, obsessive compulsive disorder, phobias, panic attacks, and PTSD. In addition, separation anxiety disorder are the diagnoses that you see in children. And so basically it falls in these two categories. There's kids that are generally fearful and worried about many different things, and you'll notice they go from topic to topic. And then there's kids that have like real specific things, like I don't want to be separated from mom, or I don't, I can't handle going and socializing with people. Then there's, specific school anxiety, and phobias basically are the ones that are specific. So anxiety I point this out to let you know, anxiety could be so many different things and appear in so many different ways, but it's a little easier if you think about it in terms of a couple of different categories, either general or specific. Main point is that kids are now struggling even more because of the pandemic. The most recent statistics that came out this week are showing that as many as 30% of Americans, that didn't specify kids or adults, now qualify for a disorder of clinical anxiety or depression. So this is an uptick in a very short amount of time for our numbers to be increasing. And so we know that that's a clear correlation to the pandemic. What kids are saying about this is they feel like their whole life has been canceled. And so this is why it's coming out as anxiety. They're saying things like, I can't do anything. Pandemic-related anxiety has become a new buzz term that we're using because we're trying to capture, like, what do we even call this? It's basically the whole world has an adjustment disorder, but we also it's specific to the pandemic, and it's not irrational. Much of what we're hearing about kids' anxiety, like fear of germs, we used to call that OCD, and we wouldn't think anything of it. Now, it's absolutely based in rational thought, and there are rational fears related to this, but it is still hijacking the emotion and their brains. What we now know is that mental health crisis is going to be the second wave of the COVID pandemic. So it's already starting. The isolation of being at home is starting to manifest some different symptoms of anxiety, though, not just worrying. We're seeing things like kids excessively talking about being bored out of their mind, and acting out because of that. They're talking about being angry and frustrated. Parents are saying they're being resistant to lots of feedback. They're talking about being tired all the time. They're getting a little bit more rough, like roughhousing. They're doing things like numbing out, which I talked about, like excessive gaming and delving into electronics. And this is in direct connection or consequence of being anxious, not being very metacognitive. Kids are not metacognitive by definition, which means they have a hard time thinking about their thinking, knowing why they're acting or thinking the way they are. So they're not able to connect dots the way that adults often have that insight. And so they're just kind of responding to something they can't quite identify and then acting out in different ways. But the root is often, if we look at it, we would say the root cause is anxiety. And what we want you to know is that what you're seeing is real. Our population, our parents that are in our group are most likely we belong to this group probably because our children have learning disabilities or mental health diagnoses. Certain populations are really, really hit hard during the pandemic. Anxiety is much more increased in certain populations, especially for kids on the spectrum. And I would say just a slightly lesser degree, but still significant for the sensory integration, sensory kids and ADHD kids. They're being hit very, very hard because of the adjustments to all of the things that they need to do. And just a couple of words about autism for the kids, for the parents of the kids that are on the spectrum. These kids are really, really struggling. They already had a baseline higher number of comorbid mental health diagnoses, and so much of it is all anxiety. So anxiety disorder is the most common comorbid, secondary condition that kids with the autism spectrum have. So they already have phobias at baseline. Forget COVID. Before COVID, they had all of these extra sources of anxiety. And so the numbers are just to kind of point out, it's huge. And our main thing is that intervention really depends critically on having all types of services be able to work together, but everything is being negatively impacted by COVID because of access issues. Even if you can access providers, you're accessing them in a different way that's hard for them to adjust to. So this last entire part I want to just point out is that there are a lot of things that parents can do. I just want to point out this one little joke that I always make, which is never in the history of calming down has anyone ever calmed down by being told to calm down. So that's like just our parent, or even just as a human, that's our instinct to always say like, calm down, it's okay, relax. But as parents, and to try to become confident leaders for them during this time, it's not helpful. So the first thing I say is that's not helpful to say. The most, you've had, I think, Dr. Green speak for SpedNet before. We have to really, really take this to heart, even more so than ever before, that children can do well if they can, right? So right now, this is where we're at, that they often can't because of COVID. So we adults have to figure out what's getting in the way so we can help them. We know that anxiety is getting in the way. And we have to remember that there are some things that we're doing during COVID that could exacerbate things. We have to know that all the behavior that we're seeing is them communicating. It's their form of distress signal. It's them telling us, because their behavior is serving a function. They're avoiding things more than usual. They're regressing more than usual. They're losing ground. They were able to do certain things and now their skills are lagging even more than they were lagging before. There are things that we should always keep in mind to avoid accidentally reinforcing the behavior that we are seeing. I'm going to talk about that in a minute. The promising part of all this that I just want to point out is that our goal to try to right the ship during COVID is really just to focus on the life skills. So they will come out of this in it's an opportunity for growth is what we're explaining, right? That they will come out of this in a stronger sense. Think about in a stronger way, they will know how to tolerate uncertainty. Right now, we can't tell them when we're going back to school. Probably not September, honestly. Like, we don't know when it's going to be. However, we don't know, and yet we are still maintaining calm and saying, okay, today, this is what I know, this is what I can do. And so focusing on trying to not have them have exposure to adult conversations, and especially COVID-related news and media is really important. They need to know those general coping skills for the future. That's why they're going to come out of this in a better, stronger way. Because they'll know how to handle when things come up that disrupt their lives in the future. We're going to talk about relying on structure and routine and only what you can control. I'm going to show you how you can talk about using common emotional language. And this is something that I talk about so much with parents, and it never sounds intuitive to any parent I ever speak to. So, but it's very important when it comes to anxiety. I didn't mention this, but I'll say now, the number one treatment for anxiety is actually exposure to the thing that you were anxious about. And so when we provide too much reassurance and we say things like, honey, it's okay, don't worry, that's going to be all right. If we just kind of sugarcoat everything, we're not actually exposing them or allowing them to feel feelings. And so reassuring, even though it's our natural instinct to say, calm down, it's okay, and you're going to be fine, nothing bad is happening, all of those like extra, really kind of false statements, because none of that do we know is true. When we make generalized statements of just everything's fine kind of statements, that doesn't help them to actually cope with how they're feeling in the moment. So modeling kind of calm behavior, which is, what do you do when you're starting to lose it, right? We in prior talks, I've talked a lot about, trying to maintain this model of, okay, I'm going to take a break. I'm going to take a walk. I'm going to do some breathing. I'm going to do stuff to self-regulate. Modeling that is literally putting your oxygen mask on that's going to save them, literally. You being as calm as possible. I'll show you one slide where it explains how it kind of passes on to them. I always include in presentations a few resources that, even though they're not new, I cannot possibly not include them because they are the tried and true standards. They're evidence-based. They're the things that we would use no matter what. And so there's still nothing better than using a common language to teach emotions to kids. And so when you go to Zones of Regulation on the internet, you find all parent resources. Many of them are free. Being able to explain to kids that it's best to talk about their feelings. Anxiety is something that they feel when they're in the yellow and then approach into the red zone. Being able to kind of give them that core language is the best thing that we could ever do in terms of teaching them about emotion regulation. And that is something that they will continue to keep with them for the rest of their lives. Another thing that parents can do is kind of know when to get help from a professional. So that would be when you see the signs of clinical anxiety that I showed you on the table in that first, one of those first slides. And also when you start to know and look for the outward signs of anxiety. So when you start to see, pretty common concrete things like nail biting and picking and fidgeting and having difficulty making eye contact, sleep changes, trouble sleeping, somatic complaints like their physical body starting to kind of say, I feel sick in my stomach and in my head, those kinds of outward signs of anxiety. Those are indicators to have an evaluation with a therapist. When you also see, we're seeing a lot with COVID, that there's regression. We have academic regression, we have emotional regression. Developmentally, kids are really, really having a hard time. And when they're anxious, they want reassurance. And so they're, more likely asking to sleep in your bed now. I just want to normalize this for you because this is something all parents that are, maybe privately in their own houses going through this, but maybe not talking to each other about. It's expected that things like this are happening. So things that they used to be able to do, like, you used to be able to say to your 10-year-old, go to your room, get dressed, brush your teeth, and come down to breakfast. Maybe now they can't because they are distracted. They're getting, they're off course from where they were before. So these are some signs that you might want to ask for professional help. When you start to see more tantrums or meltdowns, I just kind of pointed out the differences between them. It doesn't really matter. The end result is that tantrums are more purposeful. They're trying to, we say, use alligator tears to kind of get what you need from your adult caregivers, right? But whether it's a tantrum or a true meltdown where they have no control over their emotions, either one, if you're seeing more occurrences of kind of tantrum acting out, melting down, those are indicators that we need to do something to help them with soothing. And that may be getting professional help. I always include this one reminder that for parents to know that the sequence of how we intervene as parents always matters. If we can be calm, if we can be able to regulate ourselves, there's this process called co-regulation where you're self-regulating and you're sharing that with your child. So see in the picture for regulate at the bottom, the adult is down on the ground. So kneeling or sitting, being eye level with the child completely changes everything. So being calm, being in a smaller space and not towering over, or face-to-face, toe-to-toe, which is a fighting stance, right? If you're down and just regulating that you are calm and you're sitting maybe like Indian style or your legs crossed or so, sitting on the ground. If you show that you're sitting there and you're very soft-spoken, speaking slowly with few words, and being able to show that you're doing breathing, those are the things that they will naturally, without you saying, come sit here and breathe with me. They will actually start to mirror you. So those are some things that if you start to do before you try to jump ahead to reason and talk through problems and how they're feeling later. When it comes to anxiety, you cannot speak to an anxious brain. We have to always remember that reasoning doesn't work. It's like talking to a drunk person. And that's the best analogy I could possibly ever use with parents is think about talking to somebody who's drunk. If your brain is hijacked or under the influence of anxiety, you cannot talk to it. You have to first calm it, regulate it, and then be able to reach them. So it's my number one recommendation for parents trying to learn how to kind of share their sense of calm with their kid. So as I say, it starts with actually us doing that work to be really calm ourselves. And when I mentioned that there's outward signs of anxiety, this is a slide that I found from the internet about really does kind of capture lots of different physical symptoms that we might not have often attributed to anxiety. But basically, we have to think of anxiety as not just in our head. It is clearly in our body. And kids, when you start to see the physical, actual manifestation of anxiety, that is the line in the sand when you start to say that this is clinical anxiety. So you don't have to have a DSM. You don't have to have been a therapist yourself. You're a parent, and you know that when you see your child go over the line of not just worrying, but they're starting to physically experience it and have to withdraw from people because of it as well, those are the dividing lines where you say that they need extra help. And I wanted you to know, because so many people are asked whether their kids are having panic attacks, and I talk to parents who just say, I just don't know, or they use the word, but that's not what they meant. It's important to know what people really experience when they have a surge of anxiety that comes over them in a wave that usually peaks within 5 to 10 minutes and crashes over them like a wave and then goes away. That is a discrete panic attack. When you see those kinds of physical fear-based reactions that kind of surge, come and go like that, those are signs that your child is having a panic attack. And it's very important that if that starts to occur, that's your line in the sand as well to get professional help. And this is just a reminder that when we're home, because we're all home, what kinds of things can we do to try to get back to basics and do some things that are soothing? Right now, my daughter is downstairs and she's painting an apple for some team-wide community thing today. And she was so happy to just do nothing like academic, but just paint, something sensory and calming and beautiful to look at the end. We want to think about like calm down kind of activities to be able to just kind of get back to that basics. And I wanted to empower parents and make sure that they know that there are some self-guided ways to explore getting help while you're home. And then we'll talk about how you can shift and change to having professionals help you as well. But there are parent-based programs where you can follow along a anxiety curriculum that is approved for kids that's between 7 to 13 years old. That's what it's been studied on. And so it's based on the cognitive behavioral treatment that's approved for children. And it's a 12-session self-guided, parent-guided program that parents can use to help their, kind of guide their child. It's more than a self-help workbook. It's an actual 12-session guided treatment. And it's been around for such a long time. And I always say that sometimes it's a helpful first step. Unless you see serious signs of distress, you would want to go first, of course, to a professional. But if you want to explore options at home, I think that that's helpful to start with, and then you can increase it by then going to a professional and saying, okay, I've done this. Can you do this or something similar with them? Because guided by the professional, it would take it to the next level. So there's steps, incremental steps that parents can take to try to work on things at home first. Another way that people can work on having their child kind of follow breathing techniques and be guided to do it is to use biofeedback software. And so the one that I think has been around the longest and I have always used in the office, and then there's the home version of, is the one that I put the link to here so you could try it at home. It is basically a fancy way, biofeedback is a fancy way of teaching a child and the adults in their lives how to use breathing to bring back a sense of calm, focus, and be able to not be hijacked by the emotion of the anxiety that they're feeling. It teaches them how to use their pulse and their breathing to bring themselves back to calm. And it's technology, kids love it. I have always introduced it to kids and to adults in the office, and then they go home and they do it on their own. And it really, truly is something that can be self-guided. And so in COVID land world that we're in now, I really think that it's a great first step for kids who are anxious to try to start doing something like this at home. There are very tried and true helpful resources that are vetted. You know, instead of just telling you go to Google, go to Amazon, I wanted you to have some specific workbooks that I've used. For young kids, maybe up to like 12, I would say. The one in the middle, I love so much. It's What to Do When You Worry Too Much. I have no vested interest in any of these books, just so you know. But when you look at the Worry Too Much book, I love that it literally breaks down these really big concepts of cognitive behavioral therapy and specific coping skills, like writing down your worries and putting them in a box, and and having a designated time of the day where you write down and download your brain. Things I would tell you as a therapist are in there in simple to follow language that parents can use to read the book along. But the first chapter is just really an introduction for parents to understand that the whole rest of the book you just read together, and even kids that are like, you know, maybe 10 can just read on their own. And so these books are really, really helpful. And then when you have kids that are a bit older, anxiety is a language that is harder to talk about. There's some pride that sometimes kids feel in not wanting to admit that they're anxious. So it's a different approach and a different kind of language that we use with teens. And so these books are really keyed into that language that I think really speaks to teenagers better. And these are workbooks that go through how to handle anxiety and specific CBT or cognitive behavioral skills to work on anxiety. And then I'm just going to pass through that these are a few slides to show you different stress management apps. And these are the ones that are tried and true that have been being used for the longest time. Calm, I continue to use myself all the time. It's extremely helpful with guiding someone through breathing. And then, so this last part is really just to point out that I think my biggest message that, you know, I had to learn myself too, because my own daughter has an IEP, and I had felt definitely just like everybody else, like, okay, we're all stuck at home and away from our service teams, and, you know, what can we do? You know, so now I think much more so that I needed also to be reminded that it's important to get back out and connect, and the professionals have worked this out. I do teletherapy and it works perfectly fine. I think that there was an adjustment period where, you know, being able to contact providers or getting tutors to be able to be tech savvy and be, you know, online and available to us in the way that we needed them. Just overnight, we lost everybody, right? So getting our team back together is really, really important. And now people are very successfully getting back into having reading tutors online and occupational therapy, even speech and language, which arguably I think is the most difficult to try to do. But therapists and even play therapy, all different types of therapy that could help a child that has anxiety, all of those things, you know, once they have their services back and bolstered and supported for them, their anxiety levels can go down. So it's really important to not just have a professional back in your life and connect with them via teletherapy. It's really an anxiety reducing approach to make sure they get their service team back together. And that might mean that because we're about to end the school year, so it might mean that we need outside people. It might not be the special education teacher who's going to be the reading specialist for you over the summer. It might be time to switch and find some tutors in the community. And I just want to, I cannot possibly speak for all these other providers, but I think that what I'm seeing is a very wide range of lots of providers that have now switched to online in a very effective way. And for many, this is not the first time that they're having to use technology. But for a lot of them, the kinks in their systems, the availability of these professionals are now restored. And so I think that we need to think about reconnecting with them. Right now, we can feel like we're on hold, but in general, we're not. So we want to go back and see if we can have evaluations be done to get objective data on our kids and be able to see what to do for their treatment. And we can have anxiety-specific therapies delivered by therapists online. We can have parent coaches. If you feel like your child would not be a good candidate for teletherapy, you can have parent coaching sessions instead. Professionals can teach them how to improve their sleep, which is another kind of backwards way to teach them about anxiety because it naturally works on that. And we really want early intervention. We know there's a spike in anxiety rates right now. We need to act just as if we're trying to stem the tides of all the academic slide that's happening. We're having emotional slide as well, and we want to intervene as quickly as possible. So teletherapy does work, services can and should be accessed, and we want to make sure that everybody knows that. I always have these resources slides, and I just wanted to point out this one thing. Treatment resources are not people that I specifically can attest to. They are just people I routinely refer to. And so, take that for what it's worth. I'm not like specifically endorsing a specific person, but there are local resources that I think are really important that are using telehealth, are doing evaluations. I noted where I saw some of these local resources and whether they're taking insurance or not. And so I wanted you to see, if there was psych testing that needed to be done. One of the pediatric practices that's local to us that's available. People that I know and professionals that I know that are online. The system is working. And then, as always, there are vetted websites. And an added piece about this last piece is just how to talk to kids about COVID. These are excellent articles. One is even a cartoon comic strip for quite young kids to help facilitate talking to kids about COVID. And I would highly recommend any of those articles. And this is just coping resources and tips about how to contact somebody if you were in crisis, not just for anxiety, but crisis in general. And that's pretty much the end there for us. I just realized I did not put my contact information as my last slide. So, is it Janine or Lena? Lena?
Yeah. I mean, anybody
when I
have any questions?
get my slides, I'm going to actually add a slide at the end. I forgot to put my contact slide at the end. I'm sorry.
So if anybody has any questions for Mary, please use the Q&A button. Oops. Oh.
Oh, there it is. Okay, this is all new. We never had any. Oh, do you want me to read it?
You go ahead. It's
okay. Sorry.
If I do it.
This is all new. We never had any issues until now. My 6-year-old is having trouble sleeping for the past 3 weeks. She can't go to sleep without me. She cries a lot. I'm nodding because I get it. She cries a lot and says she is scared of the dark. I consulted her pediatrician. We bought new night lights and a musical pet that projects stars on the ceiling that worked for 2 to 3 nights. She now wakes up 2 to 3 times a night. She is scared that something will happen to me. The pediatrician is recommending a sleep expert. Should I use a sleep expert or look for a therapist for her anxiety? It's so I'm always, so careful about not contradicting any professionals that you're already working with. But I think that it's a perfectly valid option to do either one or even both, because the approach is often different. A sleep expert, for example, there's a man in my office who is a therapist who is board certified in sleep medicine. He is a sleep expert and a psychologist. So that sleep expert might be the therapist referral that you needed. Or it might be like a sleep apnea kind of medical evaluation. I'm not really sure. But there could be reasons, and very valid reasons, to go in both directions. And so, yes, I think that a therapy referral makes perfect sense, because there's a thing called sleep hygiene, which is an entire set of recommendations that we go through with parents and for adults as well. And it helps to identify the sources of the insomnia, but it doesn't rule out medical reasons. So if there was a medical thing, I think it's important for them to be able to, it's actually on the website already. I forgot about that. So I think it's important that if you you address sleep hygiene, it's done at least with a therapist, but it also might need the medical evaluation. And then the last person was asking about whether the slides would be available. Yes, they're already on the website. Yes, you can also look at the recording to watch the webinar again. And then the other question was, any suggestions to help a 17-year-old with motivation to help her complete schoolwork? She has anxiety and depression and has a very hard time with schoolwork. That actually sounds very familiar with the kinds of questions that we have with the more executive function focused webinar. And they are one and the same kind of the kids. They have anxiety and they have executive functioning difficulties. And often because of the anxiety, they have the executive functioning issues. So being able to do schoolwork, it's a valid approach to have a therapist talk with them about their anxiety and reduce that picture so that they can get ultimately to their schoolwork. So it's sort of like a root cause issue. Often the motivation and the difficulty doing schoolwork, if anxiety is in the picture, anxiety should be the target, and it cleans up a lot of the picture. And then what's left over are lagging skills in executive functioning that can be kind of focused on last. That would be my direction. Thought. So there's also chat, right?
Yeah, so we would encourage to use the Q&A because it's easier. But sometimes people are typing. I feel like we need some like elevator music because it's kind of those weird Zoom quiet.
Exactly.
We'll give it a minute or so. Maybe we got a few more questions.
Thank you to Danielle. So that's what the difference is. Q&A is something that gets archived and then we have all the answers.
Yes, so that's why it's so much, we can track it if we answer the question, whereas the chat just goes on and on and on and it gets really lost.
Right, okay, makes sense. Okay. So the sleep, I don't know why I did not include, but I'm going to add the link to the weightless music that we always give out to people that has the binaural beats. And sleep science really endorses using to try to help promote sleep. So when I add my contact slide, I'm going to add that resource, and that'll help the person who was asking about sleep as well.
All right, don't really see anybody, so
Just saw one other thing.
Oh,
Any
sorry.
suggestions?
It just came
Any,
in.
okay. Any suggestions for dealing with lack of structure in camps this summer? Um, I think that there's a lot of good virtual camps, and virtual camps can be very effective if because it's really just it provides structure. It provides, kind of feeding the brain information, keeping them active, even active in learning, and active in having structured, activities, because it's really hard for parents to come up with things that might be able to keep them occupied in a productive way all summer. So I think virtual camps would be really helpful. And then, is it okay to allow children to regress, or should we discourage it? My 12-year-old wants to sleep in bed with me now. So this is such a hard question, because it's not that we're necessarily allowing it. I think we're responding to it. I think that when we see signs of regression, it's important to say, okay, I see that you're having a hard time, and maybe, acknowledge it rather than just, okay, this is a new thing, now you're back in my bed forever, right? That would be like, we're not really talking about the elephant in the room. But to give the kind of long-lasting reassurance that they need, it would be, well, let's talk about it so I can see, what do you need to actually feel better? Because one night will turn into two nights will turn into 10, and 10 will turn into the next year. So, and it's very common. I've treated kids as old as 17 or 18-year-old boys that are still sleeping in their bed. Much, much older than you'd ever expect. So we never see that train coming until we're there as parents. And it's just a very real possibility. And I see a skewed sample of kids that really are having a hard time. So I see that there is this group of kids that can end up getting back into that pattern. So I know it happens, and we want to avoid it. So what I said before about like avoiding reassurances, I think that something that's productive is to say, why are you feeling like you're, needing reassurance right now? So you could provide it in a real way that would be long lasting. I think that would be more helpful. Okay. My child is constantly worried about her grandparents passing away. She is always asking about death. She is worried about something, me, her mom, happening to me. This started back in November when she was still 5, and that's before COVID, right? It sort of went away, but it is coming back up now. She wants to know how old I will be when I die. I reassure her that I am okay and will be with her for many, many years. I try to respond generally. How do I address this? I feel like it's coming up because of the virus. So she was 5, and now she's probably like 5 or 6. Okay. So I think this is extremely common, not to minimize at all what you're going through, but I just wanted you to know, in the grand scheme of things, I think it's extremely common for that specific age group, and even for older kids. And someone else was just mentioning they're having the same issue about focusing on death. So yes, so it's coming up. And again, like I said before, these are not irrational thoughts that kids are having. They're connecting that they're hearing about death, they're hearing about virus, they're hearing about uncontrolled, unpredictable circumstances that has us hiding in our houses, right? This is literally, they're responding appropriately to think about death. So I think that it's important to give the same kind of answers that you have, and just explain, maybe even use some of, I think it's pbs.org in the link that I included that has a comic strip that's perfect for her age, that talks about what a virus is, the controls that we do have, and to focus on that you are okay, to give some factual things. And I wouldn't worry about this being, I think it's a natural blip that should be coming up. And the added factor is that it's very hard for kids who are under 8 years old, who are not concrete thinkers, to understand that death is forever and what death really means. So we have this developmental piece that when they're that young, they're confused, really confused about what this all means. So you can start by having a discussion about what your family believes about what happens, what death means. But you can also say, based on someone being only 5 or 6, that this is, I sometimes use the word adult world. Like these are some adult things that that you don't have to think about or worry about. I think it's more helpful to put it aside like that, and say that you're okay. When you have like a teenager who is talking about death, they understand the finality of death, and you can have more sophisticated conversations. And it depends if you actually have had somebody who has passed away, or they know of somebody who's passed away, to talk about it in more detail. So it's always a age appropriate kind of answer that you would have to give them. It's such a complicated issue, but definitely know that this is something that is natural to be coming up. And I think it's important we don't ignore it, because if we kind of talk about it and then can put it away, it's much better than flinching and not thinking and talking about it. Okay. I'm just looking at the chat first. We need our elevator music again.
I know. You don't want me to start singing, so.
Oh no.
So we'll give it another minute. Usually with the typing, it takes a little while.
Is it like can you see bubbles like when you're on an iPhone?
I can't.
Oh, okay.
It just pops in or pops out, unfortunately, because every time I go to close it, it pops up. So usually it takes, I want to say like 30, 40 seconds.
Okay.
If people are typing.
Okay.
Just want to be mindful of.
One of your strategies, Mary, in the calming recommendations was a child literally being rolled up in a blanket. We used to have burrito days where the kids fly out and we would roll them in comforters. And I actually did it with them once just to see what it felt like. There's no better feeling than being wrapped up tight.
Absolutely, that's exactly what I think. Like yoga mats and even just like blankets are good for that. And it's like a hug. Mm-hmm. It's this gentle pressure that just makes it, it's like when you were swaddled as a baby. And that's what it simulates. It really feels great. And we learned that in like OT interventions, for sensory sensitive kids. But at the same time, like any child who has anxiety and is trying to self-regulate their body, when they feel that sensation, an anxious kid responds to it in the positive way.
Oh, it definitely works. Yeah.
Yeah. I used to do Riley burritos with my daughter.
Nice.
Yeah. All right. Well, I think we're seeing some dropout here. People are kind of logging off. So I think we can. Oh, look at that.
And weighted blankets. Yes. The one who asked about the sleep expert was saying that her daughter wants her to sleep in her bed every night. How old is she? Is the main question I have, because it kind of changes my answer. But sleeping in her bed, 6. Oh, okay. It's funny, I'm seeing the same exact issue actually happen with mine, and my daughter's 7. So we're all in this, right? So I think that is a very nice transition, being able to pull away from letting her be in your room to then being in her room with her, to then being able to then take the next step of not being with her again completely. So then it's not like an on-off switch. It's a little bit more of a like a weaning process. And again, it's important to ask, what are you feeling? Because around this age, things like monsters under the bed start, and questions, like that come up. But so that you can more, specifically address what the fear or the concern is. I think you already said you did the night lights. I'm going to send in the PowerPoint a link to it's called Weightless. It's music that sleep science and sleep medicine is studied. It's the most widely studied piece of music, and it helps people promote falling asleep and staying asleep. And so soothing routines is part of sleep hygiene that a therapist goes over with you. And a soothing routine is, having a certain very short activity that you do, like reading, then maybe rubbing their back, putting that music on, lights off, and then always the same routine to be predictable, and leaving that music on all night. It's a comfort. And also somebody pointed out a weighted blanket to add to the mix absolutely is a helpful thing. Okay, I hope that helped. And nothing's in the chat, right? Okay. Oh, that's great. Oh, okay. She falls asleep to music and it only lasts 45 minutes. I'll look for the link. Perfect. Perfect. Good. All right.
All right. I think for the sake of time and everybody's time, and I see people dropping off here, so I think we probably gonna call it a day. It's Friday. I want to call it a day. It's 1 o'clock.
You're already at the beach.
I know. That's why I'm calling it a day. It's 1 o'clock. Friday. All right. Well,
Great.
thank you so much, Mary.
You're welcome. Thank you, guys. Oh, great. Thank you.
All right. We will see you soon.
Bye.
Bye.
Bye.